think that the lifetime costs are huge, but I think intervention in the beginning can save money and make quality of life better for our veterans. It seems like a lot of the problems stem from access. A lot of problems stem from education. It's particularly difficult in rural America. We've tried to do some things. We've tried to enhance mileage, tried to get more clinics out there, tried to get telemedicine going, more employment counselors in rural America. The challenges are many. This is not a fair question, but I'm going to ask it anyway. If you're going to look from a rural America perspective, the challenges that are out there, we've made some improvements. Is there more we need to be doing, and what areas would you invest in if you were sitting in this chair?
Yes, sir. There's a lot of room for improvement, and that's what we hear consistently from our members. One thing that I think is important for this committee and for this entire town to really wrap their heads around is that right now only 52% of our generation of veterans are enrolled in VA health care. Only half. So we've got to think more creatively. The country thinks that the VA is the one stop, the only solution, the silver bullet that is going to solve all the problems of this generation. And the VA, I know, is improving. Obviously, we're disappointed they're not here. They have a long way to go, but we've also got to think more creatively. And I think we have to have a sustained effort that invests in community-based nonprofits, that enrolls the private sector, that involves the faith-based community, the people who are in those rural communities, because the VA has not innovated as a nationwide model. It's still catching up from 30 years ago in every way, shape, or form. So what we've seen as successful is involving those communities, leveraging technology especially. I mean, that's how you can get to those folks where they have decent access to the Internet, but that does give you a tremendous opportunity for innovation and for impact. You're not going to be able to bring everybody 400 miles to the nearest facility. So we've got to think creatively and find ways to invest in the community-based solutions that are working. Find those pilots and then take them to scale. Because that's where we see in the field the most consistent entrepreneurial attitude. It's that community-based church group or VFW hall or folks who are at the point of attack who are trying to deal with those problems. We haven't seen a lot of innovation that's really been encouraged and taken to scale outside of the VA. So that is kind of, I think, a big bite of the apple that we as a nation have to start to take on. And the President's got to reframe it as well. He's got to talk about more than the VA when we talk about veterans.